everyone. It has been a minute, but I'm so excited to be back here with you today. My name is Stephanie Van Bark, and I am a small business owner. Welcome to Just Talking Business. Today's guest, well, first of all, let's address the elephant in the room. Yes, I have a new hairstyle. It's only temporary. The afro will come back, but it's just something I wanted to do for the summer so I wouldn't have to do my hair. So, at any rate, our guest today is a doctor, and I'm excited about this show really because we haven't had a chance to interview a doctor. I want to learn about how the medical business works, and in particular, this medical business. I'll bring her on, let her tell you who she is and what she does. But thanks. Tune in. Hold on. Hi, Dr. Boomy.
Hi, how are you?
Now I'm saying you're right. Am I saying your name correctly, Boomy?
Yes, I go by Boomy, Dr. Boomy.
Okay. Well, we'll start with who are you and what do you do?
I am Dr. Boomi Agboola. I am a physician. I am triple board certified in 3 specialties, but I mainly practice in one, and that's pediatrics, internal medicine, and allergy immunology. So I mostly practice in allergy immunology. I have my own allergy clinic in DC, but I do see patients virtually pretty much from Maryland to Florida. So,
Okay. So we'll know to call
um,
when we need you. So now, okay, so I was intrigued when you told me you were in this area or specialty. First of all, because you're a doctor, you're the first doctor I've been able to speak to who owns her own practice. But I mean, this is such a specialized industry. Um,
yes.
how, let's start with who do you market to? How do you get people attracted to come to your services? Come and partake of your services.
So I will say most patients look at who takes their insurance. I think because we've gotten to the point that most of us have insurance or are dependent on insurance, whether it be through our employer, things we
Mhm.
bought on the market, or maybe like Medicaid or Medicare. First things first, before they waste their time, a lot of them want to know who's taking it before they start looking to calling around to see who they can get in with.
Mhm.
So, being on those insurance panels, that's usually how most patients find me,
Mhm.
just by seeing who's in network to take their insurance. Other ways that patients have found me is just kind of by referral, whether, because I'm a specialty, a lot of patients first see their primary care physician or they present to the emergency room or an urgent
Mhm.
care. So, get referrals from those places because they usually are first line in
Okay.
dealing with most patients and most patients' conditions because maybe they don't know what's going on. But then after they see a physician or so, they diffuse the situation and say, okay, well, you need to follow up here. And that's how I also get patients.
So, how would you go through? Is there a way you might be able to really encourage more referrals? Or within, as you're right, I have insurance, and I got to be honest with you, I generally pick someone that's just close to me.
Hmm.
Is there anything you can do to stand out a little differently with this referral process or through the insurance platforms?
I mostly do a lot through education and holding
Mhm.
programs with like schools or like fraternal or sorority organizations that work in the community. I also talk to the community where I might go out like at a fair or a game, or if I just see people, I may walk into the store and I see a baby with some really bad eczema, and I'm like, you should come and see me if you don't have someone already.
Right.
So it's
Right.
sometimes just as simple as that. Like,
Because I can hear what's going on with that baby.
I can hear what's going on. The baby doesn't need to suffer, but she needs to take care of you. Take care of
Exactly. I got you. I got you. I got you. So here, did you intentionally decide to go into this field, or were seeing the potential, or did you just kind of happen upon it?
Well, kind of both. Okay, so like with medical training, it definitely is intentional. So, you first start off like we all start off as like medical students, and we're
Hmm.
all trying to explore through our different rotations, like what we're interested in, what we want to do. At first, I thought I would be a hematologist oncologist, so dealing with like cancer or blood disorders or something like that. Did research in it, got awards in it. But then when I got into my residency training, where you really start to put your hands on patients while you're
Mm,
being supervised by a bigger doctor, so you don't mess anyone up.
exactly. Thank goodness.
Right? Thank goodness for medical training, right?
Exactly.
For super.
And make sure there's somebody there to make sure you don't mess nothing up.
So when I really started to get my hands on the patient and deal with patient care, I realized I didn't really like the oncology as much.
Mhm,
It was very taxing, and I'm a very big empath. So like people having bad prognosis and stuff like
mhm.
that, it's just mentally for me, it was just not the go to. And I thank God for the doctors that can do
Right,
that on a day to
right.
day basis, but it was not
I
for
agree.
me. So, along I continued to do some rotations, and then it was actually during my hematology rotation that we went and saw immunologist speak. And that was
Mhm,
the first time that I realized I could still kind of get the things that I'm interested in with the hematology using the immunology side and do something else. So then so the other side, so it's allergy and immunology. A lot of
mhm.
people know about the allergy side because that's allergy is just your immune system reacting to the external environment or something that you're ingesting, versus like the immunology side might be more like science based, and there's a few conditions that go with that, but those aren't very common. So then I was like, like let me explore this a little bit more. And I loved it. I
Good.
loved it. So yeah, did research with asthma and all sorts of stuff. And I was in love. It was
So
meant for
what
me.
made you decide to open up your own clinic? Did you feel did you feel there was a niche you could touch and specialize a little bit more so than what was happening in the ecosystem?
Yeah, it's like when you work for a system. So, like, I've worked for hospital systems, I've worked for big group practices, but really to get the environment that I wanted to have for my patients, that more one-on-one care. Like,
Mhm.
you call if you really need to talk to me, you will actually get to talk to me. You don't have to talk to 50 different people because they're like, well, so and so's on call. That's who you're going to talk to. Now, of
Right.
course, we need breaks, but guess what? I tell my patients I'm going on vacation. So it's like, not to call me.
And you can with what you're doing. You can. You could walk away for 2 weeks and we'd be all
So
right.
it's like, do you have everything you need? Do you need me to send any refills before I go? That more personal level. And I wanted to have that. And I also wanted to make sure that I was in an environment where I could, have the patient population that I wanted. And
Okay.
that's really serving us.
Okay.
Um, so yeah, and then it's just like I know I could do more. So a lot of times, and a lot of things that they don't tell you when you work for other systems, that things that you do outside of work also count as work for them, whether it
Okay.
counts as marketing
Okay.
or it counts, or you can't do things that may step outside of it. So like say I wanted to partner up with a tech company to introduce some new technology.
Mhm.
I don't have that ability, but now with my own practice, I can implement that
Mhm.
quickly.
Yeah,
And
you
like,
can.
there's one company that I partnered with to do asthma monitoring with. So, like,
Okay.
sometimes you don't capture that person in the clinic. Sometimes they need to take the device home so that they can capture those events while it's happening. So you have that data. But I couldn't implement something like that on my own working for someone else.
Okay. So you have a little bit more control, basically.
Yes. Yes.
So now, one of the things I like to do when I'm talking to someone is to really kind of look at what the industry, how strong the industry is in terms of revenue. I have to be honest, the number was so big in your industry, I don't even know how to say it. Never mind. It's the medical industry. What is that?
It
Um,
is huge. It is
but it
huge.
did prompt me to think a little bit, and I know this was a question we said right before we came on. How do you generate revenue? And through what you're doing, how do you make the money? Again, I don't know your dollars and cents, but you know
Yeah.
those of us that don't know just assume that it's all through insurance and there's some kind of transaction that happens with insurance, and then I may get a check back, I may not get a check back. You know what I mean? Have you found it to be a lucrative opportunity for you?
Yes, so basically we bill for services. So whether it be a service of you just seeing me in the clinic, so me not doing anything, we're just talking, maybe I'm writing some prescriptions, I'm doing an exam. So that's one type of service. Then there's procedural services. So
Mm-hmm.
like, if I do a breathing test or an allergy test, those are procedural services. Now the thing with those also have costs. So material, equipment, stuff like that. So, kind of like with any other business, you would need to make sure your profit margins are there by sourcing your cost materials and how much you would make off of each unit that you supply. And then, mainly, so patients really are the revenue. I know it sounds kind of crazy, but in this medical industry, things have been monetized down to like even the smallest things. So,
Mm-hmm.
so yeah, mostly fee for service, and it's usually the insurance companies that pay me. I mean, patients may pay their copay at the office at that time, but for the rest of the services, the insurance will pay usually about 80% or more of it. Now, that's another thing. You make your own bargain with the insurance company. So, a lot of times they want to pay you as little as possible because, if you're paying your premium, say it's like $400, and they pay me maybe $100, they get to keep that 300 that month.
Absolutely, absolutely. So
So
you
they don't,
so are you
go ahead.
negotiating your pricing with them as well?
Yes. So when you
Okay.
sign on to take insurance with each company, you agree to take their service. Well, let me step back. So for every service that we have, there's a billing code for it.
Mm-hmm, mm-hmm,
So like medical coding and billing, that's even an industry in itself for people who want to get into that.
mm-hmm.
But for every service, there's a billing code to it. So they'll say for this billing code, we'll pay you $100. And I might say, well, no, it's really $200 I want.
Mm-hmm.
And maybe we'll meet somewhere in the middle. Maybe we won't agree. Maybe we will agree. If we don't agree, then usually there's no contract between me and that insurance company. So when
Okay.
patients feel like, oh, well, they don't take my insurance, it's limited, likely because they could not come to an agreement on billing. And there are some insurance companies that are notorious for being cheap, I should say. They're like, you're getting paid by the patient. That's why they honestly have bigger profits than any
Then
doctor could ever
anybody
have.
else? Okay.
They're in the
Okay.
billions. They're profitable in the billions, the insurance company, health insurance companies.
I can see that because it's a crazy amount of money that we're paying anyway, and
Right.
so
And people want to
I can't,
have it,
and
you
I
know.
can't imagine. And I'm not prone to going to the doctor a lot. I don't have to. I'm pretty blessed. So I did the math one time, and I was like, man, I paid a lot of money in health insurance.
Yeah, I mean, it's both like I took a class and it's kind of like actuarial science and medicine. And most people don't even come close to what they're using up in a year in premiums. So you spend about 10,000 a year
Uh huh.
in premiums in some sort, whether it be like your copay, deductibles, and your premiums. It's about 10,000.
Hmm.
Well, they already know that the average American is going to spend that or less. So it really only comes into benefit if you are really sick, there's an
Uh-huh.
accident, you have a really bad diagnosis, like you need cancer treatment or something. That's what we have insurance for, because that's really where you're worried about the expenses being so high, maybe
Right.
even into the millions, and you don't want to go uncovered.
Right.
So, because I catch 22.
It is. I guess I was like, man, look, I don't want to be sick. I'm blessed to have the opportunity, but I don't like wasting money.
I know, right?
Waste of money. I like wasting money. So, let's see. I so wait. Okay, I had here. that I looked at your Instagram. How were you affected by the pandemic? Did you find that your services waned some?
I mean, technically, we're still in one, but yeah, it definitely waned. Now, at the time that the height of the pandemic happened,
Mhm.
I was at a group practice, and this is what was so crazy. So, when I first signed on with them, I had just moved to DC, and they were just kind of like, "Well, how do we know you're going to stay, right?" And because I don't have any family in the area or anything like that, so they didn't really know like what brought me to the area, but I knew what brought me to the area. And said, well, I don't plan on leaving anytime soon. So they signed me to a very ironclad contract that I wasn't going anywhere for 2 years, no matter what, right? So when the pandemic happened, they were like, can you cut down on your hours? And I was like, no. My contract told me I have to work these hours. I have to make this much. I have to be here. And they had no way to wiggle out of it. So they continued to pay me even though I had no patients. So I just basically used that time to plan my steps for
Exit.
possibly opening a
That's brilliant. That is brilliant.
I'm
It's
like, they
time
didn't want me
to
to
go.
run. I know we didn't foresee a pandemic or anything, but
Right.
I was just kind of like, God was looking out.
It worked out well. It worked out well. I mean, they said it's funny. The pandemic really shifted everybody's thinking about what they wanted to do and where they wanted to be. So,
Yeah,
unfortunately for them, they didn't
I know.
care.
But it was so funny to me, like the people who actually did like come into the office during the height of it, like this is when the beginning of it, like when everyone was still kind of scared, like we
Right,
don't know what this is.
right.
Um, Oftentimes it was people who were like, I never get a chance to go to the doctor. And so
Oh, okay. I guess
I guess I might as well go. I don't really have anything else going on.
that's,
I
that's
never
the
get a
aftermath thought right there. I get to go to the doctor.
I never get a chance to come in.
You know what that was? People were so tired of being in the house, they were just
I
going
think so.
just,
That'd
I'm
be a
going
good
to the
excuse to
doctor
get
if I
out.
can get to the house. You know, we don't normally like to go to the doctor. You know, we don't like that. That's hilarious. That's hilarious. Well, that's a good thing that you were able to transition, to your dream anyway.
Yeah.
I was reading your bio and noticed that you are both a doctor and a landlord, um,
Yes.
which is double duty, I would imagine. And I think, if I read correctly, you own real estate in two different locations. I,
I
I
do.
mean, if I don't even know if you can, but if you can talk us through how do you manage your day? How do you manage
Yes.
um, being sort of on all the time?
I would just say thank God for family and friends because, so I own property in Chicago and DC. And like my mom's still out there. Some of my good friends, one of my good friends who's my property manager is in Chicago. So, outsourcing to other people
Okay.
because you can't be everywhere all the time. And with real estate, I like somebody where a phone call and they can be there.
Okay.
They can
Okay.
watch the place, they can do whatever needs. If there's a flood, if there's whatever, I know what's going on. There's eyes and ears there versus like you don't know what's going on with your property. So I never would recommend that you not know what's going on with your
Mhm.
property
Right.
and don't have someone who can really put boots to ground if you need to. Now, with me being here in DC, I started a short-term rental with the one that I have here. Now, I've done it
Mhm.
before in Chicago, so I already knew what the setup was like.
Right.
So I know also what attracts people to the area. The one issue I'm having right now is finding a reliable cleaner. So
Really?
guess who cleaned it yesterday? I cleaned it.
Are you serious?
I did. I can't find anybody. So,
See,
those skills will always come into handy. Doctor by day,
right.
cleaner by
But that's
night.
entrepreneurship. You go from being CEO to janitor in a heartbeat. Like, it's just,
In a heartbeat.
you don't have a cleaning service, somebody's got to do it.
You gotta do it, and I am not too good to do it. Trust me.
Exactly. But then in your office, are you sort of the same thing? Because it feels a little like it's a small, intimate practice. So it sounds like you're sort of the practitioner. Are you also the billing person, or have you contracted that out? Are you also the,
Hmm.
you've got to stay on top of your numbers? How do you manage it?
Absolutely. So I feel like I am definitely a jack of all trades in this practice right now. Getting to know everything intimately. So, I'm HR, I'm tech, I'm I'm the CEO, I'm the doctor, I'm a lot of different things. So I do have an assistant,
Okay.
as the practice grows, I do have plans for hiring more and
Okay.
offsetting some services so that I can get more things off my plate. But
Right.
with every service that you bring into your practice, it costs money. So that's why there's definitely a growth plan in place.
Okay, good.
But you know what? A lot of it was just me taking the time out to really learn what I needed to learn in
Mhm.
order to make that step happen.
Okay.
Um, Thank goodness a lot of different companies that I do use have outsourced. I mean, not outsourced, but just made the process a lot easier. Like you could do payroll online, you could set it up
Mhm.
easily online. The EMR services, the electronic medical record service that I use, they have a lot of different programs in there, which include billing. So then like when the bills come back, say it gets rejected, then I'd send it to an outer party to go and fight for whatever it is with the insurance company so I can get that back. But
Okay.
trying to keep costs as low as possible.
Okay.
Um, and just so go with steady growth. Luckily I'm already kind of good at technology, so it
Mhm.
wasn't like much to once I had a Wi-Fi connection, I knew how to set everything else up. It
Okay.
wasn't. Yeah, it was. So once Comcast came in, I was like, okay, I got it from here. I just needed
As long as I pay everything, all my
access.
technology, I got line. I got to make sure my technology is in place.
Yeah.
But you think you're sitting in the office and you think about your doctor, but I typically just don't think about they're running a business as well. So how do you, and is your business? Are you able to manage time between sort of a 9 to 5, Monday through Friday, meaning that's when you touch your patients, or are there occasions where you have to go above and beyond?
So yes, there could be emergencies where I may need to answer a patient's call. Um, I don't, I haven't had any situations where anybody needed me overnight, like between the hours of midnight and 6 a.m. Because most people are sleeping. Like if you're, like, say you have a food allergy and you're having anaphylaxis in the middle of the night, I guess the biggest thing I would wonder is like, why are you up?
Why
Eating at this
don't you go
time
to
of
the
night?
emergency room?
And you definitely need to go to the emergency room. I definitely prepare my patients for accidental ingestions, maybe especially during the holidays, it can get really, really crazy. Maybe grandma didn't know you had a new food
Right.
allergy and she gave it to you anyway. She was like, whoa, I didn't know. Like around the holidays, it can get really,
My
really
bad.
crazy. Right. Sometimes when
But I
you see
love
the
you.
family and the one who looks so guilty, and you're just like, look, it is nobody's fault. You didn't know. So a lot of counseling as well.
That's that nut allergy.
But I
So
try my best with and giving patients a lot of anticipatory guidance. Like this is what you do when this happens. This is what you do when that happens. So just in case there's a small chance that you can't reach me or you can't reach me in a timely manner, you know what to do for life-saving measures.
okay, and so I'll go back to day-to-day operations. Or look, no, I'd rather ask this question. So in this medical industry, what have you found, even throughout the pandemic, as this industry is, this huge industry? What do you think are some industry challenges, and what challenges may be specific to you, and how have you been able to overcome them, or have you been able to overcome?
So my biggest challenge, being someone who went out of the system to start her own thing, is that now you're a small fish. Okay. You have less bargaining power when you're a small fish.
Mhm.
So, like being in a group practice with several physicians, say you had, five of the six medical practices for a specific specialty in one
Mhm.
area. Well, the insurance company has to work with you because if not, they don't have anybody to send their patients to. So you're
Right.
likely to get a higher reimbursement. Whereas if you are solo, they could say, well, you don't matter. We
Right.
are going to give you this, and you should just be happy that we're even talking to you. so so because of that, I mean, it can kind of change the landscape of things. So like there's a lot of private equity groups who have bought clinics, who have bought practices, and they're binding them together, and then they're negotiating with the insurance company, so they're getting a lot of profit. Whereas if you try to say solo, maybe you're barely meeting your margins. But
Mhm.
dangerous to me um that's kind of dangerous to me because it kind of takes away patient choice. So maybe they didn't want to go to that doctor. Maybe they don't want to be in that healthcare system because they weren't treated well. And that was
Right.
another thing that I've noticed, like for my patients, they, maybe didn't get the best service or they were treated like a number.
Mhm.
And we know medical bias exists.
Yes,
And they were like, I'm not going back there.
absolutely.
And so I'm an option. You can come to me. But if I can't survive on my own because I'm not getting the revenue, even though you're paying the same premiums, all doesn't matter. But the part that they're giving me is so small. So now it's like, I'm trying to balance things out to
Right.
make sure that I can stay open in order to see you. So it's a constant fight. It's a
It
constant fight, but it's one of those things where I supplement also my clinic with other services that, some people may consider like cosmetic or
okay.
integrative. So it's more cash pay, so I can negotiate better with the patient, um, versus like with medical services that are
Mhm.
strictly like health related.
Right.
Then needing the insurance company and bargaining is like a whole different landscape.
Okay. Yeah, that does sound like a very good idea. So you definitely, I could essentially come to you for both health and potential health and wellness initiatives as
Yes,
me as well.
yes.
Very great, creative idea, actually. So what's next? Where do you want to take this business? Where do you see your growth plan in tomorrow, 3 years, 5 years, forever?
So I'm thinking of possibly opening up another clinic maybe in another year or two. I definitely am also a real estate person. So right now I'm renting my space, but I hope in the next 3 years to be able to buy my space and have other businesses in the building. So we'll
Do you
see.
own the
That's
building?
the goal. No, I don't own this building.
Wow. I was going to be all
But I
excited
want
because
to own my building. I want
I,
to own my building, have other commercial real estate going on in there as well, maybe some residential um, properties as well. So it kind of in one, maybe like a
one big.
multi complex building. So that's my next goal is to do that and to move my practice in a building that I own because I plan to be there for years. I don't plan to work for anybody else
I'm not
anymore.
leaving. I'm not going anywhere. But speak to, and I'll tell you why I'm asking this. In my area, in my community,
hmm
we've been asked a lot about how do we think there are some measures by which, or what do we think there are some things we could do to help businesses scale? And I've screamed until I'm blue in the face. Own a building, and that's is
Ah,
the kind of
okay.
in a wealth building for a business. And so I think it's very interesting. And you are, being in real estate and an entrepreneur, speak a little bit about your theory around, the importance of owning your own facility.
Yes, and I know sometimes people can have some hesitation because you're responsible for fixing anything wrong and this
Mhm.
and that. But I always say this, they're not making any more land. And when you have a service like mine where you're kind of the demand, you're the supply,
Hmm.
and the demand will kind of come to you no matter where you are. But I mean, within reason. But
Right.
the asset is likely to appreciate. You can also create revenue off of that asset. So like right now, I'm paying rent, but if I own the building, yeah, I could pay rent, but then also the other businesses in the building could pay rent to me. So then really that even helps even better with my margins to make
Hmm.
sure that I can offer my services to patients who may be paying out of pocket for a lower price. So it all
Exactly.
comes back to, you know, it makes me more accessible for patients to come and see me,
Okay. Okay.
because I never really want like cost to be a burden, but there are limitations because things cost just to keep things running.
Especially in the medical industry, the perception of the cost. So, how do you combat that with? I think you shared earlier you really sort of target an audience that looks like us. You know, that's always a challenge when you're talking about the expense and inability to maybe have insurance. You know, what are some tips you may give to both the consumer and an entrepreneur who has this, in the similar industry, um, trying to target that community, but understanding the biases and limitations?
Yeah, so one, definitely knowing the demographics of the area and who maybe, like, so like where my clinic is, and the patients that look like us mostly live in like Southeast DC. Some areas, working class,
Hmm.
upper middle, and then you have those who are in poverty. If you identify someone who's impoverished, but they need to see you, I'm not gonna lie, I've given away my services for free
Okay.
before.
Okay.
Now you can write it off for taxes, so there's that back end benefit.
Hmm.
But there are limitations, and I'll tell the patient, like, I could do this for you, but I can't do that because the cost is too high.
Hmm.
However, either do maybe a small payment plan, like if you could do $25 a month, or we can try to set you up, get you on to Medicaid, Medicare if you're eligible, because usually, unless there's only like a income variety where some people fall into the pitfall of, not being able to be eligible for Medicaid, but then their job doesn't pay them enough
Hmm.
to really want to opt in for the health insurance. So they're trying to, just kind of get by without it. So I usually work with those patients, you know, whether it be like a payment plan or something like that. And I also try to give them as much help as possible as once, because for a patient that's usually new to me, I'll usually put them on some type of medication, have them come back in about 2 months and see how things are doing. Whereas a patient who's paying out of pocket, I may say, okay, well, I don't need to see you in 2 months, but maybe if you can just give me a phone call and let me know that that medication is working for you. Yes,
Okay.
I want to examine you. Yes, I want to do another breathing test or test to make sure that things are proper and that we are adjusting things right. But unfortunately, maybe we try to put a little band-aid on things to
Mhm.
try to get you to maybe a 6-month appointment, so this way they're not so frequent, or until we can get you on some type of insurance or whatever the case may be. So
Okay.
yeah, I try to work with my patients in their circumstances.
Very cool. Very cool. So I think that's all the questions I have. The minute I learned you were a doctor, I was like, oh my God, I want to talk to her. I want to find out how she gets paid. What happened? How did she do this? Um, but first, I will say, I think you've shared that you're doing some consultations in Miami. Please tell us how we can find you if we
The
need
best thing to do is to go to my website, aleraallergy.com, and Alera spelled Ilera, and allergy Allergy.com. There you'll be able to book appointments if you wanted to. You can, call up to the office and set up anything. Um, Yeah, that's the best place to find me. The email is there. I'm accessible.
Cool, cool, cool. Thank you so much for agreeing to join us today. I learned some stuff. I hope the guests did too. I don't have any
Hey,
allergies
my
right now,
pleasure.
but I know who to call if I do.
That's right. You know, I got you.
Thank you so much.
You're welcome. It was a pleasure.
Hey, everybody. Thank you so much for tuning in today. If you do have some sinus problems or allergies, I highly recommend her. Not just me. I know someone else who said the same thing. So give her a call. I'm sure she'll do a great job for you. And thanks for tuning in again. We will see you again next week. Have a great day.